Welcome to my interview with Dr. Kaveh Alizadeh. A lot of people ask me questions about aesthetics, plastic surgery, things like that, and I don't have the answers. So I'm bringing in an expert who does. We're going to be meeting Dr. Alizadeh in just a minute, but I want to tell you a little bit about him, and he'll be joining us from his IG on Park Avenue, where he's been a plastic surgeon and a professor of surgery for 24 years. And he was previously the chairman of plastic surgery at New York Medical College and served as president of New York State and Regional Society of Plastic Surgeons after running the oldest and largest clinic in the United States. So there's nobody better to be talking about aesthetics today than this doctor. I'm excited to talk to him and learn about the latest advancements as well in the field of aesthetics, including his innovative approach to breasts and lifts, and something he calls Natra Bra, which is a procedure that we're going to learn about, and also his global health initiatives and all the amazing things he's doing to help people restore from trauma through plastic surgery. Okay, here we go. Let me see. Where are you, doctor? I don't see you yet. He'll be joining me soon. So Dr. Alizadeh has performed over 10,000 operations, successful, no less. He's trained over 100 surgeons. So he's a teacher, he is a surgeon, and he's been the lead investigator for the FDA on breast implants, injectable fillers, fat reduction, and wound healing devices. So he is on a constant mission to learn and expand his business as well. And I will be bringing him in just a minute. Where are you, good doctor? There you are. See you, and I think you need to request. Here we go. Here we go. Thank you for joining me, doctor.
Hi, Christina.
Thank you so much for joining me.
My pleasure.
This is really a fun conversation to have because I think so many people talk to me about aesthetics and who to go to and what should I do, and I'm this age and what's going to change, and what do you think about this and what do you think about that, and I'm like, I don't know, like talk to your doctor. So I'm so glad to bring you in. You are a leading expert in plastics and in surgery, and you've done a lot of help for people who have had trauma and optimizing their good health as well. So I want to jump right in. I already gave a nice introduction for you. And let's start with the state of healthcare. And how do you fit into that?
Yeah, I would say, state of healthcare in the United States is one of growth, some of which is good, some of which is not good. So growth in terms of age, we have an aging population. We have over 80 million Americans now over the age of 60, and that is going to take off. So I don't know about you, but I'm a Gen X. So for those of us that are Gen Xers, you're looking at 1 out of 5 being age 65 by the end of this decade. So with that, it means you have this increased demand of people that are going to need not only aesthetic needs, but also your joints falling apart, your body falling apart. So there's going to be a lot of demand for healthcare. And then you also have a growing population in terms of girth, right? Obesity being a
Big
major issue.
problem.
Yeah, so you have 1 out of 3 Americans that are obese and 2 out of 3 Americans that are overweight. Obesity by itself is probably the big player with regards to chronic conditions. And again, my field comes into play because of the introduction of some of these new medications now that everyone has heard about, Ozempic being the lead, the GLP-1, which is essentially going to cause, hopefully, bring people back along the spectrum of weight loss, but that's going to have its own set of needs when it comes to plastic surgery. Right. So I think, if you look at the American healthcare by itself, it's the third largest economy in the world after US, China. If you literally count our healthcare economy is over 4 trillion, and so a lot of it is preventive, but a lot of the issues that we have is with regards to how to prevent diseases. But the things that we're really good at are elective. U.S. health, with regards to American innovations, is always comes in when you can really intervene from an elective standpoint. So we can talk about a lot of the things that are really exciting, things that you can sort of think about and say, okay, if I know at this age in my life this is what's going to happen to me, how do I intervene earlier to be able to prevent that from happening? A
Yeah.
lot of exciting stuff, but also the demographics are sort of pushing us to be a lot more responsive with regards to aging and the weight issue that we have in America.
So getting ahead of your health is the gist of what you're talking about. And you've been in business for a quarter of a century. And what are the main changes that you've observed over that time? And what are the main drivers of the trends that you're seeing today, like the diet, medicines, stem cells, and all of that?
Well, I mean, I would say probably the big trend that's happened is this personalization of medicine. More and more things are getting customizable.
Mm-hmm.
It used to be that you would say, listen, at a certain age, something bad is going to happen, and that's just how it is, right? But if you think about, right? It used to be like, listen, you're going to get old, and then you're going to get a heart attack, and then they're going to do a bypass procedure on you, and you're going to be in right? That was sort of expected, the sort of the trend that what would happen. If you think about it now, all these interventions are moving downstream. So the disruption in healthcare has been to have less invasive things. So you start taking, first of all, starts with diet. And then if something is happening early on, we're doing some of the a lot easier medications that you're taking.
Mm-hmm.
There could be cholesterol lowering medications or blood thinning medications, simpler things. And then when things do get sort of a little bit more involved, you may move on to getting an angiogram or having a stent placement without that invasive. So all of that is literally happening across the board when it comes to orthopedic interventions, where you can just do an arthroscopic thing, or maybe abdominal surgery where it's being done robotically, right, with minimal incisions. Same thing in my field. It used to be that we would say you have to wait until you're 60 before you get a facelift, right?
Mm-hmm.
60, 70. Now things, I mean, how much is it moving downstream, right? You have girls as early as their 20s that are sort of doing
Oh,
preventive
wow.
work, rejuvenation, right? But
So
we,
let's talk about those beauty rituals and procedures that are on the rise. And do they have a positive impact on people's overall wellness? And is this something you've seen and observed in your patients?
yeah, listen, as human beings, we can go back to the time of Nefertiti. We can go back thousands of years ago, and you see examples of
Snake
how we're always,
oil.
yeah, well, snake oil is the dark
Yeah.
side, right?
Yeah.
But we're always driven to be and present our best self. I know this as both a cosmetic surgeon, as a reconstructive surgeon. If I have a young child who's had a dog bite and have, a terrible deformity, they want to look as good as they can within who they are, and we call that normal. But someone, for example, has an ear, their ear sticks out, or a nose is not quite right, or, they also want to look their best. So everyone has this need. There's this internal wiring that we have where we want to present the best of ourselves. Now, there's some really interesting studies where they show you, they'll do an MRI on you, and when they show you a younger picture of yourself, that
Mhm.
lights up your pleasure networks. So that tells you that there is this internal wiring where we want to be the best representation of ourselves. The problem is when we chase it too much, right? The enemy of good being perfect. When you chase it too much is when you get to that dark side and you fall prey to the snake oil that you
Mhm.
mentioned. And what is the ultimate thing that's selling the snake oil these days is social media. So that's, I think, the balance where you have it's moving to younger and younger populations, right? Who may not necessarily be able to decipher all the information that's out there and who's the expert and who's not. And that's when you're going to get to the dark side of the aesthetics, where this pursuit of perfection together with non-experts, telling you
Yeah.
things, you know, that, and we spend so much time educating people about how they're miseducated, right? So
Yeah.
try to bring them back to the
And
fold.
social media has such an impact too on how we perceive ourselves, and that's probably a main reason why it's getting, the average age of someone doing cosmetic surgery is getting younger and younger. So, in your experience, how does cosmetic surgery affect overall well-being, and does it reduce stress and anxiety as a result of getting the what you want, the change that you want?
Yeah, I mean, I would say that. I mean, that's one of the beauties of my profession that really is so gratifying. You know, seeing our patients. It could be a breast procedure where one of our patients, let's say we just saw today that she had a beautiful body, then she had multiple pregnancies, right? She felt that she lost the body that she had.
Right.
She's in great shape, but she can't connect to that what she sees in the mirror, right? So we're able to sort of bring back that connection between who you feel you are and who you see yourself to be,
Hmm.
right? So that's the best part of it. Um, I think that the other part of this is that you just mentioned, with social media, there was a great study that came out that showed that when especially young girls are in the phone, when you see yourself in your phone, there's a relative disproportion of your measurements of your face. That's not objective. So you see it as being objective, but actually your nose is much larger than you think, right? Your
Exactly.
lips appear thinner.
And they're
So there's this
also holding
fisheye.
the phone like this, so everything
Exactly. So everyone's neck thing
is
is happening. So all
amplified.
of
Yeah.
these things are creating this sort of a anxiety about things that may or may not be true, right? And then you're getting feedback from people that are trying to tell you things. So I think there's this balance between, we know for a fact that when you do simple procedures that have a huge impact, for a little boy or a little girl who has like their ear sticking out in school and they're not feeling, socially connected, doing a very simple procedure, tremendous difference in terms of confidence, right? A woman who sort of feels that, they never really quite, never was, things were not quite there. Even I'm doing liquid rhinoplasty now, where just a tiny little change in the nose, huge difference within minutes, right? But then you have the other side where people are sort of feel like, I can only get there by doing X, Y, and Z, and it's not really based on a uh, real reflection of, what I just told you, because they're seeing things in a weird angle, weird lighting, and they're just
Yeah.
super focusing on that. So there's two sides to this that we have to constantly juggle all the time.
Good for business.
Good for
Bad
business if
for,
it's done by the right, that's why you need to have someone who's very ethical
yeah.
and gets to say no. And you get to see a lot of scenarios where, unfortunately, listen, we see Hollywood actors and
Yeah.
actresses who fall prey
And
to
you
it,
know what?
right?
They're just going to go somewhere else and where they get a
Yeah,
yes. So it's
yeah.
also about education. And you are an educator. You're a professor and of plastics, and you've taught for countless years. Give me some examples of new innovations that have been game changing in your industry.
So along the lines of what we were just talking about with the whole personalization of medicine, you have, I think, I would say probably the introduction of stem cells, exosomes, the ability to regenerate and repair the body
Mhm.
is remarkable. And it used to be something that you would have to be part of a study and you would have to be followed carefully. We still are doing it through our Society of Plastic Surgery. We're following patients that we're doing these stem cell work on because we want to make sure there's no negative effects that we're not aware of now and may happen down the line. But I would say most of those trends are along that line. So if for example, again, let's start with Ozempic, right? Ozempic was started as something that was used for people in a pre-diabetic, it was FDA approved for pre-diabetic uses. But as you learn about what it can do under the controlled supervision of a physician, you
Mhm.
can actually help nudge people that may need, 15 pounds, 20 pounds, where they're stuck. You can move them along that spectrum and have a tremendous result that can be really, listen, it's got to be done with everything else, diet, exercise. But some people are stuck and they can't make that move. So that's on the medication side, things like that. On with with stem cells, whether it's using your blood and plasma, and initially started with PRP, right, using platelet-rich plasma, then it sort of moved down the pathway of highly concentrated forms of cell mediators. Now we're using your fat, which is we can extract your fat, a small amount, and then get into the intracellular level. It's called exosomes, and use those as signaling mechanisms where we can re-inject it into your skin to help with the hyperpigmentation, inject it into the fine lines to get the rejuvenation of the skin, inject it into the scalp for hair growth, or inject it with fat into the
Oh,
breast.
that's good. I
Uh,
didn't know about the hair growth.
yeah, so using it on the breast. We're using it essentially to help the cells survive, right? You're using it for many different, you can inject it into joints for arthritic patients, people that really have lost a lot of the joint movement and are having a
Yeah.
lot of pain. So and this sort of brought together a lot of disciplines, right? You have a lot of disciplines where we're learning from each other and seeing how it works. I would say today, if I do a facelift, it's a it's it's a given part of my facelift that I'm going to be doing fat grafting with exosomes because I know you're going to have a better result, and
Right.
there's no reason for me not to do it if I can have the best result possible.
And
With my breast surgeries, also, if I'm doing fat grafting for the breast,
mhm.
I am combining with the fat grafting because I want to make sure I have the best take of those cells. I want those to survive.
What is fat grafting?
So fat grafting is a process in which we're taking fat from it's the best of both worlds. You're doing a borrow from Peter to give to Paul, right? Robin Hood procedure. You take from the rich, which is you take it from an area that you don't like, your butt, hips, belly, right? For most people, it tends to be that. And putting in areas that you do want it, which is your breast, uh, face, as I said, using it as a so we're borrowing from one area and putting in another area, and the fat will live in that area.
Mhm.
We know, for example, that when you're aging, you have atrophy or loss of soft tissue of the face. The skin thins,
Mhm.
the fat actually gets less. So, which is why you sort of have the deflation of the face, right? If you look at a young face and then look at them 20, 30 years later, essentially the face has been deflated. So the idea is to sort of reintroduce this in a very sort of the right ratios and the right correct way of returning that soft tissue fill.
And,
And a great way to do it is to use your own
and
fat.
what's the difference between using your own um, exosomes from your fat or somebody else's? Because I've had a exosome facial, but it wasn't my
Yeah.
exosomes. It wasn't from my own
So,
fat.
yeah, great question. So, listen, I think, yeah, that's usually plant-based, and there's a lot of the reason for that is because the FDA is very careful right now, rightly so, to make sure that it's done the correct way and you're not doing things that could potentially be harmful.
Hmm.
But the only exosomes that's correctly used now is your own. I can't use someone else's because of safety issues.
Right.
But I mean, it's a lot more powerful, right? If I can harness your own body's ability to rejuvenate you, it's a lot more powerful. When you have the plant-based stuff that's sort of using on the face, it's a good next step, but it's like you're here, and then what we're talking about is way up. I mean, a completely different scale of what you can do.
Oh, wow. And then, of course, there are stem cells, which are, sourced from so many different places. I mean, tell me a little bit about that because people have been asking me a lot about stem cells, where to go, how do you know they're legit and they're high
Yeah.
quality?
So this is one of those things that you got to be very careful. I think this is a really important topic because you don't. I think a lot of times when you have things that you're buying online, usually, as I said, they're usually plant-based because they can't really do animal sources. And then you don't know what is their safety standards, which country was it done in, how do they sort of process it, how do they package it. There's a lot of unknowns. What you do know, then that's why we've really gotten away from that. I think that was a starting point. I think most practices that are really on the cutting edge are using your own tissue because it's safe. You don't have any infection issues or take issues. And then the processing, and then we have this commitment as board certified plastic surgeons, at least with our society, to report it. So we actually have a database where we're reporting and following to make sure if there's any issues, we can catch it early and sort of know about it early on. That's if I do a case, I have to report it, within my society. It's
Oh,
de-identified,
that's interesting.
but that's the best way to do it. Yeah.
Okay, got it. So tell me a little bit about uh, Natura Bra and what is all that about? I know it's this amazing innovation for breast rejuvenation, but how did this procedure come about? And how does it address millions of women's needs to, create the most real version of what they had?
One of the best parts of my practice. It's a very sort of innovative way to use your own tissue to get what most women want, which
Hmm.
is to have upper pole fullness and nice cleavage without a bra to sort of create that push-up effect. It came about because I was doing a lot of breast reconstruction early in my career. I was recruited to do breast reconstruction, microsurgery, and a lot of times when women needed to have a mastectomy where you're removing the breast tissue, we had to sort of bring back the volume, and we were putting an implant in. But what we noticed, this is going back now 25 years ago, was that the implants would essentially, you had no control over the implants, so they would fall. And
Oh,
one of the new sort of innovations at the time, going back to 20 years or so, was to have an internal hammock, to use a matrix that would hold the breast up. And we were using a cadaver skin for that. At the time, we were using cadaver skin, and
oh
then you're
my.
using pig skin.
Oh,
Yeah, because you want to have something it's literally mimics a bra, but it's going inside, right?
right.
And it's been decellularized. So using that thought process, I was like, well, why can't we just use the patient's own tissue?
Got it.
Why do we have to rely on a cadaver skin or a pig skin? But the challenge there is you got to figure out the blood supply to be able
Hmm.
to rotate the tissue so it can go in place
Okay.
and hold itself and be nourished at the same time. So that took a couple of years in the lab to figure it out. And once we did it, we've been sort of working on. And the idea is it's like a bookshelf, right? You have a bunch of books that have weight to it. If you don't control it, things are going to fall. So if you can find something that's secure enough, and then we sort of hold it against the chest wall, essentially. We just presented our results 20 years out at the International Society of Plastic Surgeons in Cartagena, and it definitely holds over time. So we know that it works well, and it sort of incorporates into your body, and you don't have this issue of an implant that may potentially have a rupture or capsular contracture.
Yeah,
Implants are foreign
tell a little
devices.
talk a little bit about the widespread, panic about breast implant illness. What is it,
Yeah.
and is it important to remove breast before that happens? Like talk a little bit about that, please.
Yeah, this is just like you said, it's a panic. I'm not sure, and like most panics, it's out of proportion to what it is because there what we've noticed is that there is a very rare forms of cancer, a lymphoma
Hmm.
that can happen, or a squamous cell cancer that can happen with women who've had breast implants. These are extremely rare, but nevertheless, it's a new finding that's we've known now for the past few years. So based on that reality, FDA in 2019, they put a warning and a recall on certain types of implants that are textured, because those tend to cause these problems more than the non-textured. So I think because of that, that
So it's
created a
not what
lot of
it's
concern.
made of; it's the texture.
Yeah, it's the outer surface. So it's made out of
Okay.
silicone, and those are still used widely. You know, uh, they've been around. I mean, implants in one shape or another have been around since 1960s. Over 3 million women have breast implants in the United States alone, right? So we know it's safe, but we also have to be aware of this sort of this rising scenario and keep an eye on it. Which is again, we have there's a database through the Society of Plastic Surgeons where we're tracking women who have implants. So you have that, which is very real and very low numbers, but very real. And then you have another phenomenon that's going on, and that's probably the one you're mentioning, the breast implant illness, which is women that are reporting having a lot of immune mediated symptoms. And that could be fatigue, It could be, inflammatory changes where they're just not feeling as healthy as they were prior to the implant. It's a lot harder to tease out because it's very hard to do that step where you can sort of temporally say it was connected to the implant placement. So what we do know are the women that we take the implants out from, right? There should be a dramatic change when you remove an implant from a person who has a lot of complaints. Right now, I would say it's not quite science, it's more anecdotal. I have my own patients that I've done this for, and it's been dramatic for them. And I have patients that have removed their implants, and we do the natural bra afterwards using their own tissue. And so they may or may not. It's not this definitive thing that every woman you take their implants out, all of a sudden all their signs and symptoms go away. But again, it's something that we are listening very carefully to. We're following our patients. The good news is that we have options now. So if someone has an implant and are having symptoms and they want their implant removed, I can go ahead and remove that implant, do the procedure, the natural bra with fat grafting to give them the volume to make them feel that they have that wholeness without worrying about having an implant. So that's a nice option that we have
That
here.
is a nice option. And it's so important to know everything you can before you're going into a procedure like that. And thank you for sharing that information. So let's talk about migraine surgery, okay, which aims to cure migraines in a subset of patients that suffer daily headaches, and their headaches can't be helped with medications. I've never heard of this as a solution. Can you tell me all about that?
Yeah. Again, another one of gratifying parts of my life. I got introduced to this. Yeah, that's the thing. Like no one has heard of it, and it's been around for almost 20 years. So this is a procedure that was pioneered by a plastic surgeon in Cleveland, Dr. Bauman Gyron, who is a great innovator. And the thought process is that a lot of women, his patients, that he noticed that were coming in and reporting to him that their headaches were getting better after he was doing forehead lifts and brow lifts on them. So he was like, well, why would that be? And he made the connection that there are nerves that are passing here and here that are potentially being compressed. And in that process, if you can relieve the compression, you're also relieving their headaches. And he did a great study, very scientific study, where he was able to show patients that had the intervention without or not the intervention, and he showed there was a big difference in terms of their symptoms and the relief of their symptoms. So I started this procedure in 2010, doing the procedure in 2010. We've now seen over 1,000 of these patients. We have a headache center that we run through New York Medical College, where I'm on staff, and we publish our results, and it definitely matches what Dr. Garin initially has reported and continues to report across the country. Many academic centers are doing it. Unfortunately, it's not just you. Many doctors, many neurologists, even headache specialists don't know enough about it because it sort of has not really taken off because people like you are not talking. That's why I want to be on people like you that can sort of put the word out and do a public education about it.
Yeah,
So
I
you
mean,
have
it's
30.
crazy that it's the number one cause of emergency visits, a headache, migraine, and 35 million Americans are affected by that,
Yeah,
by headache.
I mean that's a significant number,
I have a
right?
headache
So
right now thinking about it. Oh my God.
you have one out of five women in any meeting you're in, one out of five women have debilitating headaches. You may not know about it. So it tends to be a lot more in women than men. And based on we talked about over 30 million Americans. So you have one out of 10 Americans. It is the number one cause of admission to the ERs currently in the US. So the idea here is that you should not be dependent on medications all the time because unfortunately what happens, you go to your doctor and they say, you know what, take these meds and then you just stay on it, right? It could be something simple as Furist or Percocet, and it can sort of progress to opiates, these things that sort of you're on, you need more and more medication because you depend on it. Now, how do you get through it? Well, you can just do a very simple test. If you go to, again, the right physician who understands how to manage this, go to your physician, have them do an injection of a numbing medicine into that particular nerve. And if your pain completely goes away, you're a great candidate for this procedure, which means that then we can go and decompress the nerve and potentially cure you of this, debilitating problem. But
So
it requires a bunch of steps, right, to sort of know if you're a good candidate for it or not.
someone is asking, what is the percentage of recurrence post-surgery?
Yeah, so pretty much, I think most of us who've done this and published on it, 60% of the patients have essentially a cure, which means that you have no need for further intervention if the procedure is done and have an indication for it. So that leaves about 40% of the patients that may not have this incredible response. But the other 40%, invariably, they have a dramatic downgrade. So they have less days of pain per month. And if they were a 10 out of 10, now they're like a 3 out of 10, right?
But
So
you
there's,
still get headaches and migraines then.
yeah. So the one that the other portion that I talked about, so you have 60% that are like, it's like, you turn the light on, everything's great. I don't have any,
Yeah.
I'm like a normal person again. And then, but you have that, so 89% of the patients have a response of some sort. 11% of patients have no response. And our job right now is to find out that 11%, what is it that's not working? What is it that we're missing about it? But still, if you look at medications, most medications that get approved through the FDA for migraine have like anywhere from 30 to 50% efficacy, right? We have a procedure here that has, 60% up to 89% improvement in your symptoms. Much better than being on a med, and it's a one-time surgery that can affect you. That's why it's one of these life-changing scenarios.
Yeah.
And it just happens to be that a plastic surgeon who was very thoughtful discovered it, which is why, because a lot of people are like, why is a plastic surgeon doing this? What do you guys, it just happens to be, this is what we, that's like where we work, right? We're working around the face and the nerves that are here. There's also nerve in the back of the head that we engage as well for this. But it's been really
So
cool.
a lot before we get into kind of the restorative work you've done with Doctors Without Borders and Smile Train, I wanted to ask you, a lot of people ask me this question. What is more favorable, the needle or the knife?
Well, it depends on where you're at in your life. The needle is always more favorable because it's less invasive, quick, minimal recovery. But there are things that the needle cannot do, right? So if you get to, because remember, our face, our body it's really multiple layers of tissues that have been laminated together, right? You have skin, you have fat, you have muscle, you have bone, you have ligaments, you have all these things have been sort of tightly wound. With time, they tend to sort of stretch out, right? There's wear and tear and things tend to sort of
Yeah.
separate. And then what happens with that? You get laxity. And then what happens with that? With gravity, everything tends to fall, right? So just using a needle alone is not going to fix that problem. You have to really think about methodically about each of these layers and what's happening to it and address each of them correctly with its own solution. So when it comes to the skin, I may want to use a laser. I may want to use a laser that's really going after a particular issue with your vessel or your pigment or the lines. When it comes to the dermis, the deep layer, I may want to return some turgor to it and some fullness. So that's the needle, which is, Restylane, Juvederm, right? When it comes to the muscle underneath, I may want to relax it so I don't get these lines. That's Botox, right? That sits much deeper to it. That's a
Yeah.
needle.
Yeah.
When it comes to the ligaments and the tendons and ligaments that are really stretched out and are falling, like the neck stuff, that's a knife because I'm using that to sort of suspend and replace the position of where those ligaments and tighten it to that point. And that's that stem cell that I was telling you too. There's some good evidence that using these stem cells, we can also help recondition these ligaments and everything to become more rejuvenated. So as we
Oh, that's
move,
interesting. Yeah.
yeah, so as we move this early and earlier, which is why, I think as we're talking about, as this timeline moves to earlier, maybe if we can start doing these stem cells early enough, because remember, aging starts happening at 30, like in your 20s to 30s. And then when menopause hits, it's like a nosedive, right?
Well,
From a hormonal perspective.
right. It's that senescence
That's
begins.
right.
Your
So if we can
cells
move
stop
the stem
multiplying.
cell, yeah, so if we can, again, we still need to have enough data to figure this out. But if we can move that early enough, so as we're losing the gain, we're also gaining with these stem cells. And those are needle based. So that's a good thing. All of these things are sort of moving along that spectrum. So you have less need to do more surgery later on.
We just did a story in Purist on salmon sperm. Have you heard about that as in terms of like you know, an exosome alternative or something like
All
that?
right, you gonna make me study this now? Do I have to go and study salmon sperm
Well, they're
next?
using it in Europe, and Europe obviously has stricter rules than we do here, which is always amazing to me that it's things are there that aren't here that are being offered in that space
No,
in the
honestly,
beauty
I'm
category.
not up to date on my salmon sperm, but tell me it's used in what
The
context?
same way as exosomes, I think it's applied after a microneedling facial.
Okay, I mean, I can, I mean, the concept
But
is,
in Europe, it's used as an injectable.
okay. Yeah, I mean, I have to sort of see how active it is. I have to sort of learn about the activity of it. But I think the concepts are good. You know, you either need to open a channel, which is through microneedle, right? You have to either open a channel into the deep depth of the
Right,
skin, or you have to introduce it to the depth of the skin, which is through the
right,
needle,
right,
right?
right.
So whichever way you get there, I just don't know enough about it to comment
Yeah.
to you, you know. So
There's so many
try to
innovations.
keep up. Yeah.
It's hard to keep up, but fortunately, you know, we like to cover them all in Purist. And so let's switch topics to global health. And I know you've been involved in volunteer work in the health industry for over 30 years, having worked with Doctors Without Borders and Smile Train. Um, what led you to start that mission and restore and share some of your personal anecdotes, if you can, about what we as global citizens should know about the role of health in the developing world?
Yeah, I mean, you know, if you sort of think about the core needs of every human, you know, when it comes to what we need is, you know, health, you know, a something that keeps us in a safe, it keeps us safe from a where your house and food, right? I mean, those are sort of the and a connection, a human connection. Health, unfortunately, ends up being the thing in most of the world that doesn't allow any most people in the world not to get to the next level of safety or education and all of that. So an example of that would be if you have a child that has a very simple burn injury of their hand and they get a contracture of their hand, their likelihood of being able to work in the field or work in a factory, because that's essentially the option, is gone, which means that now they've lost the ability to be useful within their community, then they're ostracized. Everything leads to everything else.
Wow.
So, so my sort of introduction to this was through medical school, where I got to volunteer with Doctors Without Borders. This is back in the 90s. So I did some work in Afghanistan, and then from there to Iran, and then back in. So we're doing a lot of work with different groups, and then in 2010, me and a group of my colleagues, we decided to start a new foundation called Mission Restore. The idea being that when this was after the earthquake in Haiti, and a bunch of us went down to Haiti to help out. Of course, we didn't realize this until we left, that once you leave, everything is back to square one, right? Because when you do a
Yeah.
whole bunch of surgeries, everyone thinks it's great, you've really helped people out, and then you leave the island, and who's taking care of them now, right? If there's an issue, what's happening? So that led to this idea of creating a sustainable educational paradigm where you're teaching the doctors to be able to take care of their own
Hmm.
within their own communities. Then the next challenge was when we trained the doctors, they would tend to leave their community to go somewhere else. So how do you create a environment where they want to stay and feel, you know, satisfied enough to want to keep going in their environment? And then as part of that, we were doing a lot of work in, you know, places where there was a lot of trauma or war, and then we decided that it's best to leave that and go to more stable scenarios. So for the past 5 years now, we've been in East and Central Africa, mostly in Kenya and Uganda and Tanzania. So we have created these programs where we train the doctor, we catch the doctors, we train them to become surgeons, and then we motivate them to stay within their own community by getting them jobs within their local hospitals.
That's so.
Uh, yeah, so that they can really help with their community.
Is that restore?
Mission
Mission
Restore. Yeah, it's called Mission
restore.
Restore. Anyone who wants to learn about it, just missionrestore.org. If you go to missionrestore.org, you'll sort of learn to see what we do. So essentially the idea is to capture the doctors, have them stay in their communities, get training there, and then help them. Right now, we're just connecting with them through social media. With WhatsApp is actually our best way of, because it's encrypted. They can send us photos. We can communicate in either a one-on-one, or we can talk about, we can pull in hundreds of doctors that give advice about a particular
So
scenario, right? So it
you've
gives you that
you've
optionality.
donated all that time, thousands of hours of free surgical training in what, 27
Yeah.
countries, with the aim of teaching these doctors how to take care of the millions of traumatic injuries that occur in
And
these
that's
remote
just the tip
communities.
of the iceberg. Yeah,
Very
this is a
impressive,
huge, I mean,
doctor.
well, this is the tip of, I mean, there is so much more need that's out there. You think
Yeah.
about, just again, we're trying to tackle a problem that's, just like I said, just thinking about getting injured at work for somebody. Or, we had a woman who had she had seizures, and she was cooking, and while she had seizures, so she fell, and then the cooking is usually happens at home, in the center of the home in Africa, right? So the hot water fell on her, burned her face,
Oh,
and she was not able to take care of her newborn. So that newborn was then given away, right?
oh,
I mean, you see every single, so whereas if you can manage that at that moment, you sort of within a couple of weeks later, you can sort of move on with your life. But these things
wow.
have devastating consequences,
Yeah,
right?
yeah. Wow. So you were able to help her and get her
Yeah. So this is actually,
baby back, I hope. Oh my
so even
God.
better. So we went there, when we were there a couple of years ago, we were able to do the surgery with one of the young docs. And now the young doctor who was in training with us, he's now in that community. This is
Oh,
in
that's
Mwanza in Tanzania. So they're actually going to have their own sort of aftercare within that community. So the idea is to really build these relationships and build a network for them so they can be sustaining
and you do a
over
lot of
time.
this training virtually.
Yeah, once we're connected with the doctors that we've met and we've trained, then we just follow up with them, because it's like getting advice. It's like you
Amazing.
calling your colleagues for advice. They're calling, hey, I have this patient I came in. Should I do, I had a patient who had a huge tumor here.
Yeah.
Not me, that well, our colleague did in Africa. And the question was, should I do the surgery? And we're like, absolutely not, because you don't know. There could be a lot of bleeding and you don't have blood there. It may seem easy, but once you get in there, no, hold off until someone comes for the next visit. So those are decisions that you only know from experience, right? You're not going to know unless you've done it.
So someone's asking, besides New York City, do you have an office in Long Island?
Yes, I'm actually sitting in our Long Island office in Jericho.
Oh, great.
I'm here. Yeah, I'm here twice a week. I'm on Long Island, and 3 days a week in Manhattan on Park Ave. Where are you? I think we're neighbors. I think I'm
I'm in
close.
East Hampton.
Well, I can see that in your background, but in the city, I think you're on Upper East Side, right?
Yeah.
Yeah.
Oh,
All
good.
right. Well,
I'm just
happy to have you over.
I'm just checking for questions. A lot of wonderful comments, telling you how incredible you are for doing that work, and it's really, really, you're a fine human. Someone wrote. So thank you, doctor, for sharing those stories, because they really make a difference, and you're able to do that because you are an innovator and you're bringing, these new procedures and helping women and men here in New York and beyond, as you mentioned, uh, figure out how to age gracefully, right? Longevity doesn't need to be, ugly, an ugly mess, right? We can be our best selves and feel our best selves, through these rejuvenating procedures. Is there anything else you want to share with us in the innovation space?
No, well, I appreciate you. I really appreciate the fact that you're spending the time to educate people about what's real and what's not.
Yeah,
So
and
keep doing what you do.
it's
Thank you.
thank you so much, doctor. And someone wrote, you're really making a major difference. So thank you, for sharing all those anecdotes with us. And I look forward to meeting you soon. And for anyone who's interested in more information, go to the Good Doctor's website. I will post it here, dralizadeh.com. What is your heritage, Doc?
Persian.
You're Persian?
Yeah.
You have all that ancient generational wisdom behind you.
Good poetry.
Yeah,
We definitely have great poets.
exactly. Rumi. Rumi was Persian, right?
Yeah.
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 Oh,
My
well, thank you
favorite.
so much for sharing your time tonight, and I really,
Have a
really
great night.
appreciate it. And for anyone who missed any part of this, wants to learn about migraine surgery, breast surgery, all different innovations in the beauty space, check out this video. I will have it up on my Instagram. And thank you so much, Dr. Alizadeh. Nice to meet you,
Have a
and
great
nice to
night.
see you, and thank you for sharing all your wisdom with me today.
Bye.
Bye, everyone.